Hello, my dear students. I'm Dr. Vaishaly Bharambe, Professor, Anatomy. What will we cover in this lecture? We'll be defining axilla and then we'll jump into the axillary lymph nodes. What are the different types? What is their location? What is their applied importance? How does lymph drain through the axillary lymph nodes? And what is the applied importance of knowing about axillary lymph nodes? You do realize this is a very important lecture. Manual palpation of axillary lymph nodes will also be discussed. Let's dive into this lecture. Understanding that axilla is the pyramid-shaped space below your arm, between your arm and the chest wall, having an apex and a base, and 4 walls, anterior, posterior, medial, and a very narrow lateral wall. It contains arteries, veins, nerves, lymph nodes, and other structures. Artery, axillary, vein, axillary, nerve, brachial plexus, and a few other nerves. Lymph nodes, axillary lymph nodes, which is what we're going to discuss today, and axillary fat and axillary tail of Spence. So this has been discussed in Axilla Part 1 and Part 2. And many more upper extremity videos can be found on my website vbanatomy.com. Do please feel free to go and explore those as well. Let's talk about axilla, part 3, axillary lymph nodes, axillary fat, and axillary tail of Spence. Axillary lymph nodes. So see, axillary lymph nodes are a group of lymph nodes which are located in the axilla. They are basically 5 groups: anterior, posterior, lateral, central, apical. There are of variable numbers, somewhere 4 to 5, sometimes 6 to 7. The numbers are given here for you. You can always refer to them. Let's talk about each of them. Anterior group of lymph nodes. Okay, so these are all the axillary lymph nodes. This one is the anterior group, which can be found just below the lateral thoracic vein. Remember the lateral thoracic vein? We've done that in the earlier lecture. It can be found there. Drains lymph from the mammary gland. Posterior group is here. Posterior group lies along the subscapular vessels on the posterior wall of axilla, drains lymph from the dorsal part of your trunk. If you're liking this lecture, students, do please like, share and subscribe to my channel and hit that bell icon. Let's talk about the lateral group now. The lateral group is found in the lateral wall of axilla, posterior to the axillary vein. It receives lymph from the entire upper limb, except for the part that drains along the cephalic vein. Let's talk about the central group now. Here's the central group of lymph nodes. They lie close to the base of axilla and they receive lymph from all the 3 that we just discussed, anterior, posterior and lateral. It drains into the apical group of lymph nodes. Apical group of lymph nodes are found here. They lie very close to the apex of axilla, medial to the axillary vein. They receive lymph from anterior, posterior, lateral, central group of lymph nodes and also from the lymph that travels along the cephalic vein and partly from the upper mammary gland. These nodes drain lymph from the upper limb, breast, upper part of abdominal wall. The efferent vessel from the apical group forms the subclavian lymph trunk that finally drains into the venous system. I'll show you a diagram, you will understand. Come, so beautiful diagram here. This is the central lymph node. This is the anterior group of lymph nodes receiving lymph from the breast, draining into the central lymph nodes. This is the posterior group of lymph nodes receiving lymph from the dorsal wall, draining into the central lymph nodes. These are the lateral group of lymph nodes receiving lymph from the entire upper extremity, draining into the central group of lymph nodes. The central group of lymph nodes drain into the apical group, which then forms the subclavian lymph trunk, draining the lymph into the venous system. The apical group also receives lymph from the infraclavicular lymph nodes and from the mammary gland itself. So this is the basic way in which lymph is drained through the axillary group of lymph nodes. I have tried to make it as simple as possible. I hope you enjoy and learn from it. Right. So when are axillary lymph nodes enlarged? Why are we talking about them? Right. So nodes can enlarge if there is infection of the upper limb, shoulder, thoracic wall. One, infection. What else? Breast cancer. Axillary lymph nodes are the primary site of metastasis in case of breast cancer and therefore are regularly scanned for any kind of thickening in the possible age group of females. It's a very important part of cancer staging, okay? Block dissection of axillary lymph nodes. So axillary lymph nodes are enclosed in the facial tent of axilla, like I taught you last time. So anteriorly formed by clavipectoral fascia pectoralis minor. Posteriorly the posterior muscle subscapularis and so on. Medially lateral chest wall covered by serratus anterior muscle. The apex points upwards, the base directed downwards. In this space lie your axillary lymph nodes. When you're dissecting them, you have to ensure that you stay within these walls. Block dissection of axillary lymph nodes is done, keeping this facial tent in mind. Indicators for block dissection: carcinoma of the breast, malignant melanoma of the upper limb or shoulder when the nodes are involved, and certain soft tissue sarcomas or skin cancers. For all these reasons, you might have to do a block dissection of axillary lymph nodes. What is axillary tail of Spence? So here, what is the meaning of this term? You can see that a part of the mammary gland can sometimes pierce the axillary fascia, forming a foramen called foramen of Langer, and enter into the axilla. Okay, what happens is that when there is carcinoma of the axillary tail of Spence, okay, this can be mistaken for enlargement of axillary anterior lymph nodes because they are so close together. Okay. Finally, when there is central group, when they get thickened, okay, the intercostobrachial nerve actually passes very close to them. So thickening of the central group of lymph nodes can cause a compression of this nerve, and the patient can actually come to you with a primary complaint of pain along the medial side of the arm, little knowing that this pain is actually because of an early cancerous changes in the mammary gland. Right. Palpation of, so you are going to come across a regular requirement of palpating the apical, the lymph nodes, right? You have to palpate them to understand whether thickened or not, right? So how do you do that? You ask your patient to rest her, if you're talking about the left axilla, rest her arm on your left shoulder. Meanwhile, your right arm, observe the image to understand, your right hand should be palpating deep into the axilla, trying to go as close to the area behind the clavicle as possible. Insert your fingers high up into the apex of axilla, going behind the clavicle towards the head of humerus to be actually able to palpate the apical axillary lymph nodes. Rest, allow the patient's arm, meanwhile, to rest on your shoulder. The more relaxed the walls of axilla, more you will be able to palpate comfortably. Press medially and backward, feeling for enlarged or firm lymph nodes. So students, if you enjoyed this lecture, do please like, share and subscribe to my channel. Hit that bell icon. For detailed anatomy lectures, surgical anatomy videos, downloadable notes, MCQs, do please visit my website www.vbanatomy.com. Link is in the description section. Thank you, students. I'll see you in some other video. Bye.